My name is Ian Boer, and I'm professor of medicine and director of the Kidney Research Institute at the University of Washington in Seattle, Washington. I also practice clinical nephrology at the VA Puget Sound healthcare system. First of all, kidney disease is very common in people with type 1 and type 2 diabetes. It occurs ultimately in about 30 to 40% of people with either condition. Manifest as either albuminuria or low estimated glomerular filtration rate. Diabetes is the most common cause of kidney failure in the world. It accounts for about half of all cases now of end-stage kidney disease that require dialysis or kidney transplantation in the United States. And even for people who don't reach kidney failure, kidney disease markedly increases risks of cardiovascular events and premature mortality, and we'll show some data on those two associations. Also, for those of you who practice clinically, it's obvious that kidney disease complicates daily clinical management. People with chronic kidney disease have increased risk of severe hypoglycemia, and CKD begets a number of additional complications as well, such as hyperkalemia, hypertension, and acute kidney injury. This is a classic study that describes risk for cardiovascular events among people with diabetes and chronic kidney disease in the United States who are covered by Medicare. And what you can see here is that both diabetes and chronic kidney disease are additive risk factors for all of these cardiovascular complications, with the highest risks observed among people who have diabetes and chronic kidney disease. Shown here is another study of cardiovascular and mortality outcomes from the United States population. In this graph, all-cause mortality over 10 years in the general population of people without diabetes or kidney disease is shown by the dotted line, about 8%. And then you can see in the bars among people with diabetes, according to their kidney disease status, their excess risk of all-cause mortality. It is slightly elevated in people with diabetes who have no evidence of chronic kidney disease, but you can see that with the presence of albuminuria, low eGFR, or both, the risk of all-cause mortality and the data were similar for cardiovascular mortality are markedly increased. Combining data from multiple studies and meta-analysis, we see a consistent relationship that's graded between albuminuria and cardiovascular mortality, shown here on the left, and lower eGFR and cardiovascular mortality, shown on the right. You can see that with rising urine albumin to creatinine ratio, even within the so-called normal range, there's a higher hazard ratio for cardiovascular mortality. And on the right side, you can see that with lower eGFR, moving to the right, there's a continuous graded association that's quite strong with increased risk of cardiovascular disease mortality.